Welcome back to another episode of the ProNex Podcast. I'm your host, Karol Clark, and we have Dr. Chu with us once again. She is so insightful, and she, like me, has used so many different softwares and in her practice, and she also recently had to make a choice in terms of what to use in her new practice. So if you could just share us a little bit about your software, how you picked it, and your practice, that would be great.
Yeah, I've used a lot of software in medicine, from big EMRs to small EMRs. So nowadays, everyone has a portal for the patient to either track their labs, their medication use, and communicate appointments and such. But there's really no software that will be able to allow the patient real-time interface with the practice. CORE LMP would allow patients to fill out a questionnaire, but the questionnaire is integrated into the EMR so that the nurse does not have to key in their past medical history, but it's all integrated into the EMR. And then secondly, the practice also sends out educational reminders, medication reminders, and the patient is tracking their activities, their intake, their meals. This is very robust accountability tool, not just simply checking labs and checking your medication, but you're actually interacting with the practice. And the practice is, with the help of some AI, we can respond to the patient in real time, and there's not a big gap where you're having to message the practice, wait for a couple of days and get a message back. So that really helps with lifestyle, especially when you're eating something and you take a picture of your food and you're not sure what's going on. We can't tell you not to eat it at that time, but at least our practice or our software is able to analyze it and give you a feedback. It's completely different from all the other healthcare portals out there. So that's the exciting part about using the CORE LMP. It's just real life accountability tool that the patient can rely on.
Right. So somebody who's really experienced with software, it's really great. That's the solution that you selected. And you're an integral part of creating additional features for it and advancements through AI and GLP-1 tracking. It's really been a great tool, and it's been fun for me, and I know for you too, to be able to share this with other people and see people be able to eliminate numerous pieces of software, put everything into one place, and use it successfully for their EMR, for their tracking, for their GLP-1s, for everything. So
I'm glad you brought up
awesome.
the GLP-1, because half of our practice, everyone's using it these days. And so we needed something to really track their accountability and track their usage. And a lot of them would just take the medication, have a side effect, and just stop using it altogether and not tell the practice. So I asked Fred to help us create something that will allow us to remind them to take their medication, log in every week when they take it, and then log in any side effects. And then from there, we have ability to trigger our practice, our provider, to look at and see who's not taking it, and then responding to the patient with some message and some reminders and things like that. We don't necessarily have to call them, but I think sending the messages through the portals really helped people and helped us stay on top of it. The GLP-1s is, like I said, everyone's on it, and so it's really difficult to track everyone.
And probably a huge time saver for you and your team in any practice. So well, that's awesome. Well, I appreciate you coming on today to share your thoughts about software and why you chose the CORE LMP. And if people wanted to reach out to you, how can they reach out to you and contact you?
So I've been practicing in Lafayette, Louisiana, and our website is chuprecisionhealth.com.
Awesome. All right. Well, thanks again for your time. And I'm sure exciting advancements to come as well. But in the meantime, it's ready to use, and I know so many people are enjoying it. So thanks for your part in all that.
Yes, ma'am. Thank you.
All right. Have a great day.